Welcome back, Chronics, and thanks for joining me. Today we're talking about why it's so difficult to get doctors to believe us. I mean, there are many reasons, but one reason would be, I don't know, other physicians writing books called It's All in Your Head. There's this London-based neurologist who thinks we can create symptoms with our mind, like some kind of Jedi mind trick. It's interesting because every doctor I meet can't see past their specialty, and she's a neurologist, so guess where everything starts? The brain. It's really sad that 30% of people who have EDS attempt suicide each year. I just hope the last book they read wasn't yours, Suzanne. Yeah, because that's a lot to carry. So yeah, try and focus on that whole Hippocratic oath, do no harm. Oh wait, I forgot. 30% of med schools in the UK don't even have a Hippocratic oath or something like it. What do you guys recite together, like when you graduate? Dr. O'Sullivan is part of the club that many doctors are in, and it is called the If I Don't Know About It, It Doesn't Exist Club. She gives an example and talks about a patient that she was treating who was diagnosed with things like ADHD, Tourette's, seizures, anorexia, dyslexia, EDS, POTS MCAS, and Chiari malformation. She was saying we shouldn't automatically think of these because there's no pathology that can prove them. Sure, for like the first few I listed, but when you get to POTS, MCAS, and Chiari malformation, Miss Neurologist, you don't know that you can look at an MRI and see if it's there or not? Oh, you must mean that sometimes people live their whole lives and don't have any symptoms from Chiari. That can happen. But if someone says Chiari, you just take a picture of their head and say, yes or no. An allergist can diagnose MCAS. They take a lot of blood and urine. It's not a fun test. What I recommend is just trying an over-the-counter antihistamine, and if you feel better, you may have MCAS. And for POTS, we have the tilt table test, which I took, and it almost killed me. But it's all in my head. Actually, it's in my autonomic system. So this patient she spoke of tested her heart rate, her blood pressure, and those didn't move, yet she, was having fainting spells. I'm sure she took her blood pressure and her heart rate while she was sitting down. Yeah, it's going to be fine when she's sitting down. Did you ask her to stand up? Then take the vitals. What I'm confused about is that autonomic disorders are definitely a thing, and neurologists are supposed to specialize in that. Oops. We all know for hypermobile EDS, they are still working to find the affected gene, but they have already found markers that is bringing us close to finding out which gene or genes causes hypermobile EDS. So just to play devil's advocate for a second, say POTS isn't real, then how come there are societies like Dysautonomia International, or Dysautonomia Support, or my favorite, the Dysautonomia Project? The government doesn't love non-for-profits for conditions that don't exist. She really leans into autism being a great example because, cases rose from 1998 to 2018, 787%. Do you think that maybe now they just know what they're looking for and they know the symptoms? Autism always existed, but there wasn't any diagnosis for it, especially in the 90s. She was saying how symptoms like hypermobility and low BP can be normal in childhood. But if you get a doctor who thinks they're symptoms and follows it, then that kid will probably think something's wrong with them. So because of that thought, they will have symptoms that were derived from their thoughts. I would say you could use that as an argument, except when I was a kid, they told me that hypermobility and low blood pressure weren't a big deal, and nothing was wrong with me, and I was totally fine. Yet I still had all the symptoms, suffered most of my life, and really only got on the right path last week. Here's a good example. I saw 6 gastroenterologists in Boston over the last 9 years, from top hospitals, and all of them told me I have an eating disorder. And it's all in my head? No. Because once I got to a specialist who actually knew what they were doing and prescribed me the right medications, my stomach problems have almost all but disappeared. After I was evaluated by Dr. Chopra, I just wanted to cry. Happy tears because he actually knew what he was doing, but then sad tears because I have just wasted 9 years of my life. To back me up in this fight to get this woman out of Delulu land, Dr. Chopra and some other doctors are all writing letters that they're going to compile and send to her. And I'm sure that the memo will say, "Are you serious, you moron?" No, not crazy, just have MCAS. Luckily in the United States, we now have online clinics that someone created whose family all are doctors. And they all noticed several of their patients had similar symptoms. So they did what, real doctors do, research things and figure it out, and found what they had. Most of them had EDS, POTS, and MCAS, but they couldn't find anyone to treat them. This is the clinic, and I will put all the information in the episode description on how you can contact them. Apologies, this became more of a TED Talk, but I thought it was really important to correct somebody who has no idea what they're talking about. So chronics, this is why I always say, don't give up, hang in there, and don't take crap from anybody, especially uneducated doctors who don't know what they're talking about. I will see you guys next time.